So here you'll see the different levels of assist, and these are just some describing words that will help you help your client better to know how much of assistance they need to transfer or complete a task. So the first one we have is independent, and that's where the client requires no assistance from you to complete a task or a transfer, and they can do that safely without any physical or cognitive help. Standby assistance is where they require you to supervise them, so standing close by to them when they are doing a task, and they are still safe as long as you are around. And setup assistance requires that you set up some of the items, so that, for an example, it would be setting up a toothbrush and toothpaste, or setting up some of their craft supplies, and then they can take it from there. So there they can still safely complete an activity with your setup.
Alright, these next four all require some sort of physical assistance from you. So the first one is minimal assistance, and that requires that you do around 1 to 25% of the assistance, and so the client can do at least 75% of the work. Next is moderate assistance, where it requires that you do at least 26 to 50%, so the client can do at least 50% of the work. Maximal assistance requires that you do at least 51 to 75% of the assistance, so the client can do at least 25%. And total assistance, the client can do less than 25%, so it's required that you do at least 76% or more.
Before we start learning about transfers, let's first learn the proper body mechanics for lifting.
So first, we want to use a wide base of support. You want to keep your feet at least shoulder width apart. That allows for more shifting of your center of gravity without loss of balance. Second, you want to maintain natural spinal curves. Your neck and lower back should curve forward. Your mid-back curves back. You tighten your abdominal muscles to support your back, and you bend at the knees and hips with your tailbone pointing back towards the wall behind you. You want to lift the load with your legs. Muscle in your legs have a larger diameter than those in your back or arms. A large diameter translates into more muscle fibers to recruit, which essentially means stronger. You want to keep the load close. When the load is within your base of support, the more balanced you will be and less likely to be injured. The workload is decreased by keeping the load in your base of support. You want to pivot your feet. Take small steps with your feet to complete a pivoting transfer. Do not twist your back or trunk. And finally, you want to be aware where the individual is placing their hands. You want to encourage the individual to push off to initiate the transfer, and avoid letting the individual grab and place arms around your neck.
Before we complete our transfer, we want to make sure that our environment is ready and safe. So the first thing we need to do is make sure that the wheels are locked, that we have all of our necessary equipment within reach so that we do not need to leave our patient halfway through the transfer. We're going to remove any leg rests that can come off. And last, we're going to make sure that our transfer chair is close, touching if possible, and that our environment is clear of any clutter.
You're also going to want to make sure that you have a gait belt on them and it's nice and snug around their waist. And then you're also going to want to make sure if you need a sliding board that it is near you and ready for you to grab for a sliding board transfer if that's what you're doing. And then you're also going to want to make sure that the client is scooted forward on their chair so their feet are flat, their ankles, knees, and hips are at 90 degrees.
Before performing the transfer, you want to make sure you explain any of the steps or expectations from the client that you expect of them, and also give any directions to anyone in the room that's going to be assisting you with the transfer.
Okay, Alyssa, are you ready to transfer to the chair?
Yes.
Okay, you are a min assist, so I'm going to need at least 75% of help from you.
Okay.
When performing the transfer, you want to make sure that your hands are on the gait belt, not on the individual's clothing or their arms. And you also want to have the individual lean forward so their nose is over their toes, and encourage them to push with their upper extremities.
Okay, on a count of 3, we're going to stand up. 1, 2, 3. And we're going to pivot until your knees are touching the back of the chair and sit.
First, we are going to show you how to complete a sit-to-stand transfer. That is when you are getting the client from a seated position to a standing position. First, you are going to place one hand on the gait belt in the back. You want to make sure that the wrist is in a neutral position. Your body, you are standing next to the individual in a squatted position with your back straight and a wide base of support, and your head should not block the view of the individual.
Okay, 3, 1, 2, 3.
Next, we are going to show you a stand pivot transfer. That is when you're moving the client from a seated position to a standing, and they pivot to sit onto another surface. Your hand placements, you are going to place both of your hands on one gait belt on the back or posterior surface of their hips, and you want to make sure that the client's hands are free to assist you. You want to make sure that you are squatted in a squatted position in front of the individual, and that your head is on the other side of them so they can see where they are going.
Alright, so we're going to go up now on 3. 1, 2, 3. Move. Knees to the chair. And we're going to go down slowly.
Next, we're going to complete a modified stand pivot. This is moving from a sitting surface to another sitting surface by pivoting without coming to a full standing position. This is usually utilized with clients who have significant lower extremity weakness. Again, you are going to place your hands on the gait belt posteriorly on the client. You're going to angle your body towards the surface you are transferring to. You are going to have the client lean forward over their toes, and on a count of 3, you are going to lift and swing their body to the new surface without shuffling your feet.
Next, we're going to perform a sliding board transfer. A sliding board transfer is moving from sitting on one surface to another by sliding on a sliding board. This is utilized on an individual that is not allowed or unable to bear weight to their lower extremities. So first, you want to lift the hip that is closest to the surface you're going to transfer to and slide the board underneath. You want to instruct the client to place their hand on the board, but be careful not to put their fingers over the edge to make sure they don't pinch. Next, you want to hold your hands on the back of the gait belt right above their hips and help them slide across. And you want to make sure that you're not blocking where the patient is going. Now let's recap what we went over today.
So we went over 4 transfers: the sit to stand, stand pivot, modified stand pivot, and slide board transfers. For all of those transfers, you want to make sure that the client is wearing a gait belt and that you have key points of control on the back of their hips, or for the sit to stand, one hand is on the hip and the other is on the client's knee. You also want to make sure that you are close to their body and that you are directing your movements, and their surface that you are transferring them to is nice and clear, and also you're in a close proximity to the other chair. And then for the sliding board, we want to really emphasize that the board should cover a good surface of both the starting surface and the ending surface. So you want to make sure that it'll be a nice easy transition from when they push down, and you want to make sure that their hand is nice and flat and not next to the edges so their fingers don't get pinched.
We also went over body mechanics in our module. The main topics from this part of the module were to maintain natural spinal curves. You want to use a wide base of support. You want to lift the load with your legs, pivot with your feet, keep the load close when you're lifting, and be aware where the individual is placing their hands. You don't want their hands around your neck or anything like that when you're transferring them.
And most importantly, we want you to remember that safety is our #1 priority. So make sure that the wheels are locked, that you can remove any barriers in your way, such as the leg rest and arm rest. Make sure that the surfaces are in close proximity. And then make sure you're communicating with the client and letting them know the steps you're going to take, and make sure that they're prepared. And lastly, do not be afraid to ask for help if you need it.
Happy transfers.